Now we return to the textbook. The DMARDs that we just talked about are kind of traditional disease-modifying anti-rheumatic drugs, still very commonly used for rheumatoid arthritis, but occasionally, well, more than occasionally, they will try these newer drugs that are immune modulators, and they do what they say they do. They actually modulate the immune system. So they suppress the action of the immune system. These are more powerful drugs. They're somewhat newer. They require very close monitoring. So in our textbook on page 235, we've got table 2.4 that gives the newer qualities of the immunomodulators, besides the more traditional ones we've just talked to. They're used for rheumatoid arthritis and some other arthritic type diseases. For instance, Phil, is it Mickelson, the golfer? He advertises Enbrel, I believe, for his psoriatic arthritis, which causes skin problems as well as bone and joint difficulties. So these reduce the progression of the disease, and they work to make the person feel a lot better by lessening their inflammation. And when the inflammation is lessened, so is the pain. So we've got just a couple of examples here, although there are others. And the two that the book talks about are ones that are commonly talked about on TV. They're still bringing in quite a lot of money for their drug companies. So these are called cytokine blockers. They're TNF, which stands for tumor necrosis factor, alpha inhibitors. So they work directly on the immune system itself to block the action of these cytokines that respond in great numbers with inflammation. Cytokines are the chemicals that can overwhelm a person who is suffering from sepsis, severe influenza, and viral illnesses like COVID-19. They just really mount a strong defense and really sort of overwhelm the body, and actually can lead to death themselves. They fight back so hard against the virus that the person goes into just complete physical collapse. So to block these cytokines really helps reduce a lot of this inflammation. And two examples that you've heard of are adalimumab or Humira, and then etanercept or Enbrel. Very, very commonly used nowadays. They are used sub-Q, and like all sub-Q injections, you want to instruct your patients to rotate the sites so they don't end up with skin problems. These drugs can cause mild headache, and that's considered to be a fairly normal side effect. If a person has pre-existing heart failure, they want to avoid these particular DMARDs that can aggravate it, and our book talks about these on page 236. There's also on page 236 a safety tip. Because these drugs really suppress the immune system, you want to find out if your patients had TB in the past, hepatitis, shingles, if they're HIV positive with the PCP or the pneumocystis pneumonia, and other opportunistic infections, because these DMARDs will make things worse. Pages 235 and 237, we've got quite a bit of patient and family teaching that you need to look at when it comes to these drugs. These, like any of these drugs, are not given lightly. All right, let's move on to gout. I think I'll stop here, and then we'll talk about drugs for gouty arthritis.